Well, just a few days to go, and it looks more and more every day like the healthcare overhaul is having a huge impact on this midterm election. The latest bit of evidence comes from North Dakota. Democratic Congressman Earl Pomeroy voted yes on healthcare and was touting it in his ads. But take a look at the latest campaign spot.
I'd like to introduce myself. I'm not Nancy Pelosi. I'm not Barack Obama. I'm Earl Pomeroy. My values are formed right here in Valley City where I grew up. I know I've disappointed you with a vote here or there, but you can always count on the fact that I do what I do for the right reason, for the people of North Dakota.
Well, Leslie Marshall is a syndicated radio talk show host and a Fox News contributor. Lars Larson is a syndicated radio host. Panel, thanks so much for being here. So, Lars, let me start with you. So now you've got Earl Pomeroy. Instead of touting how this is going to help Medicare and so on like he was doing, I've taken some yes votes that have disappointed you, or taken some votes that have disappointed you. So what does that tell you?
Well, it tells me that he's not yet ready to say that he's going to vote for repeal, which is what 61% of Americans want. You can understand why Democrats are running away from this, screaming like little girls, hey, we've got to get away from this thing. We voted for it and America hates it. And in fact, I fully expect that there's going to be a move for repeal the minute Republicans take control of Congress. At the very least, they're going to defund it. At the very best, they might just drop a repeal bill on President Obama's desk and double dog dare him to veto it.
Well, which of course he would, and even under the best projections for the Republicans in terms of gains in the House and Senate, they don't have enough to override a veto, even under the best projections for them, Leslie. So as a practical matter, I ask you, let's say the Republicans do get in with some mandate to do something to the healthcare law, repeal, reform, defund, what have you. What realistically are we to expect?
Well, this is where I'm really confused, Megyn, because all I hear from Americans on both sides of the aisle is that they want more jobs, and unemployment numbers have declined in the past 2 weeks. They want a better economy. They want our borders secured, etc. None of which health care does, whether it's reformed, appealed, tweaked, etc. Financially, it doesn't impact America until 2014. So I think it's counterproductive to look backward in going forward. It's a waste of time and taxpayer money. It doesn't address the top 3 needs and concerns of American voters.
Go ahead, Lars.
Megyn, that's baloney. And Leslie should know it. Leslie, you're a sweetheart, but I got to tell you something. Every employer out there is hit hard by this reform. They're all being told by their insurers, yes, rates would have been going up, but they're going up dramatically because of Obamacare. And you think the rate of the cost that has to be paid by employers for health care is not impacting their ability to add jobs or to retain employees? That doesn't make any sense.
Well, there's that point. There's the point about what it's going to do to our deficit, which can be debated on both sides of the aisle. But people have partisan feelings about it. Leslie, let me ask you this. Some good news for those who support the health care law and don't want to see repeal. We've talked a lot on the show about the polls, which still, according to the Real Clear Politics average, shows that about 50% of the public is opposed to the law, 40% favors it. But interesting new Wall Street Journal NBC News poll. 52% of respondents say they'd be more likely to vote for a candidate who wanted to give the law a chance. 45% more likely to vote for a candidate who wants to repeal the law entirely and start over. So the wins do not seem to be behind the sales of repeal, at least according to this latest poll.
Well, no, and I think because if you look at various demographics, for example, if somebody is collecting Medicare right now, there's been a lot of various means of information out there, and they're afraid as a population, seniors, what will happen to Medicare. But it's also scary what happens to Medicare if there is repeal for that population. Going forward, it's not just about the deficit, and it's not just about business owners. Right now, not only as a business owner myself who owns a medical center and is married to a physician, and believe me, Lars, Megyn, I make a lot more money if we don't have reform. So I'm speaking from the heart here, not from my pocketbook. But when you look at this, I have to tell you, and I won't name my carrier, my rates have gone up 3 times prior to this legislation being passed. And appealing the legislation, we all know, does not guarantee or put any competition. Neither did this reform.
I want to point one thing out. The same poll also shows, however, on the flip side, Lars, that in the 92 House districts that are the most competitive, the support that those numbers I gave are exactly flipped. Yeah. So in terms of taking back the House for the Republicans, the news is good. But I have to ask you, Lars, do you think folks really there will be a legitimate push if the Republicans take control to repeal or defund, or is this vote we're going to see on Tuesday more about just punishing the yes votes in the first place and then that's it?
this is a practical thing. They're going to have to at least try to defund it, if not to throw a repeal. And I've had some members of Congress tell me they'll throw a repeal on President Obama's desk because they understand he's going to have to own this thing. He took ownership of it during the debate, said it was his plan, even though he didn't write it. And the fact is that when you look at that, seniors should be scared right now. They just stripped $500 billion out of Medicare. If you're on Medicare, aren't you afraid of a plan that strips out $500 billion, throws it to people who are uninsured right now, some of them, by the way, illegal aliens, and then says, hey, we'll fix it later, we'll figure out how to do it? The fact is, right now, American employers are facing real crisis when it comes to medical care costs. And Leslie, with all due respect to your medical clinic, I'll bet you're not dealing with the mainstream population. I'll bet you're dealing with an elite group, and the elite group always gets treated differently.
You're wrong.
All right.
You're wrong.
She doesn't deal with the elitists. That's it. Ever.
She doesn't, huh? Okay.
Leslie, Lars, thank you both so much. Back to the Future for real?